Welcome back, my people. Let's continue with our discussion about endometritis. And before we continue, guys, I can't forget to continue thanking you for the support you are showing me. For those who have not subscribed, please consider doing so. Back to our topic. In this video, we are going to discuss about diagnosis and treatment for endometritis. How can a doctor tell that a person is suffering from endometritis? One, through what we call positive history of having such a disease. This means that if previously you had endometritis, you can also get it again. So with this kind of a history, a doctor can get a clue, or it can lead to a diagnosis whether you are having this kind of a disease. Next, we have what we call a pelvic examination. After doing a pelvic examination, the doctor might feel some tenderness in your abdomen, which can lead to this diagnosis. Number 3, we have what we call blood testing or full hemogram. Full hemogram means full blood count, which identifies signs of an infection. Number 4, we have cervical cultures. A cervical swab, or the fluid or the discharge from your vagina or from the client's vagina can be taken to the lab and done what we call culture and sensitivity to identify or to detect chlamydia or other bacteria like the ones for urinary tract infections, which can cause this kind of a disease. Next, we have what we call wet mount. Wet mount. In this, the doctor may get swabs from the cervix and analyze under microscope to identify causes of the infection. Next, we have endometrial biopsy. Endometrial biopsy is whereby a piece a piece is cut from the endometrium, taken to the lab for analysis, or laparoscopy and hysteroscopy, whereby a scope is used or a camera to look directly. A scope or a camera during laparoscopy is used to look or directly check the uterus. What are the treatment regimens that can be used in this kind of a disease or in endometritis? How can a patient suffering from this disease be treated? It all aims at eliminating the infection to resolve the uteric inflammation or inflammation of the uterus and further complications. During this treatment, most of these infections are caused by bacteria, like the case of the urinary tract infection, as we discussed in our previous videos. So, number one treatment, you can use antibiotics. Antibiotics are only used to fight bacteria causing inflammation in the uterine lining. Number 2, we have what we call contact tracing or treating sexual partners. For example, if it's due to an STI, both partners can be treated to avoid recurrence. Number 3, we have what we call further tests. For example, culture and biopsy to identify the bacteria. So when you identify the specific kind of bacteria, you're in a position to treat it rightly. Next, we have surgery to remove tissue. In complicated cases of endometritis, it may need surgery to remove the affected tissue or any tissue directly left by a child. For example, when you lose a pregnancy, we have what we call remains product of conception, and which can risk one to getting endometritis or the uterus getting inflamed. So surgery might be used to remove such kind of things. Next, we have what we call treating any abscess. As we were discussing about this disease, we found that it can form an abscess in the uterus because of the bacteria. An abscess is something, a swelling, which inside it has pus, and the pus can only collect in somewhere where there is a bacteria. So if you treat such kind of abscesses, you'll be in the right track of eliminating such a disease from your client. Fine needle aspiration can also be used to remove the infected fluid or pus, which in return can be taken to the laboratory for culture and sensitivity, or to detect the bacteria, thereafter directing the doctor in getting the right treatment. This is the end of our discussion for today. In our next video, maybe probably tomorrow, we'll be discussing about prevention of endometritis and also its complications. Guys, I'm still thanking you more and more for the continued support. If it were not for you, this channel could not have been where it is at the moment. Guys, road to 2000 subscribers. Take me there, guys. Continue subscribing, sharing, and liking my videos. Thank you and have a good day.